Welcome back. Today we're talking about professional issues, standards, and competencies. So you've now been through the welcome and overview and through taxonomy and theoretical foundations. So let's talk a little bit about the what and why of standards. What are they and why do we need them? Well, standards provide requirements, specifications, guidelines, or characteristics that can be used consistently to ensure that processes and services are fit for their purposes. That's from the International Standards Organization. The National Institute of Standards and Technology says that they provide a common language to measure and evaluate performance, to make interoperability of services made by different organizations of disciplines possible, and it protects consumers by ensuring safety, durability, and market equity. In animal-assisted interventions or animal-assisted services, standards should cover most of these categories: health, welfare, and well-being of dogs, the dog handler. And remember that dog handler could be an outside team of a human animal that you call in to work in your sessions, or it could be you as a dog handler. So in my animal assisted treatment sessions, I handle my own dogs. So therefore I'm a dog handler. Standards should also look at the ethical treatment and welfare of the participants. So these are students or patients or clients. It should look at the very specific areas in which you practice. So that might be animal-assisted therapy or treatment, animal-assisted activity or support programs, animal-assisted education, and then they should also look and give you guidance about the administration of programs. So today we're going to take a look at some standards examples. I have chosen Animal Assisted Intervention International because I helped write those and I'm very familiar with them. And so I'm not telling you not to go and look at any of the other organizations. There are many friendly organizations in animal assisted interventions or animal assisted services, and a lot of us play well with each other. Your job is to find the organization that has a set of standards and competencies that help guide you in your development or in your refinement of your animal assisted services or interventions practice. So again, I'm going to cover Animal Assisted Intervention International, but in your weekly reading, you're going to be able to sort of skim through different ones and see which organization offers whatever it is that fits your needs. So with AAII, Animal Assisted Intervention International, we start with Section 1. This is the health, welfare, and well-being of dogs. Now, that's one important thing to know, is that Animal Assisted Intervention International at the current moment only has standards, competencies, and accreditation for people and organizations who work with dogs. We do not do any other species at this time. But in this section, we offer guidance on the basic needs and rights of the dog, the general health, welfare, and well-being, temperament, preparation and socialization, training and handling, obedience, evaluation, behavior, and assessment, and welfare during animal-assisted intervention or services. When we think about the dog handler, we do our best to offer guidance about general human interactions and how to prepare for animal-assisted intervention or animal-assisted service sessions, how to work with participants, how to engage with other healthcare and human service providers, general communication that happens in sessions, education and experience, assessment, documentation of sessions, liability insurance or legislation, and risk assessment and management. We're really concerned with safety for everybody involved. When we think about the ethical treatment and welfare of participants, we want to offer guidance on human interactions and working with participants, and again, those other healthcare and human service professionals. We want to make sure that we give guidance for clear communication and other staff or organizational structures. For animal-assisted therapy or animal-assisted treatment, we want to offer guidance about preparation, professional qualifications and ethical guidelines, competencies, mentoring and supervision, documentation, goal-directed activities, termination of services, and general public issues. So again, we look at liability and insurance legislation. The next section would be animal-assisted activity or support programs. So guidance should be given for preparation, for competencies, for mentoring and supervision, documentation, termination of services, and general public issues in this specific role. So you'll notice that while the subheadings of preparation, competencies, mentoring and supervision, etc., are similar to those of animal-assisted therapy or treatment, we're focused on making sure that there is a differentiation, because remember, it's a very different job. And so we want to be able to offer guidance for different components, whether it's animal-assisted activity or support programs versus animal-assisted education. And so again, in animal-assisted education, you see the same subcategories, but with slightly different content for the role that this team would provide. The guidance that we offer in our standards and competencies for administration of programs cover general program structures, making sure that there is some sort of a complaints policy, making sure there's a safe working environment for therapists, for animals, and for participants, image protection, confidentiality of information, insurance, and making sure that it is the right insurance. Professional liability is not necessarily what will cover animal-assisted interventions or animal-assisted services. So you've got to make sure, and we'll cover this a lot more as we head down the line, but we want to make sure that we offer that kind of guidance. And then making sure that, you know, when it comes to operating partners, that there is clear communication, expectations, and cross-training. And then, of course, we look at marketing, and if it is a nonprofit organization, such as a 501c3 here in the United States, fundraising, and, you know, really making sure that people are identifying their programs accurately. So if it is, you know, a nonprofit or a charity, then those are organizations that look for donations and sponsors, et cetera, versus in a private practice or in a for-profit hospital setting, you would not see those same things. People need to know what kind of a structure your organization is. So we can also talk about specific discipline standards. So you'll see that we have a folder in Canvas for specific disciplines. You're going to take a peek and see if there are any specific discipline standards or recommendations that are offered within that. So if you're a mental health provider, you're going to look and see what's in there for you. If you are doing animal-assisted activities or support programs, see if there's anything in there for you. Occupational therapy, physical therapy, et cetera. Now, the interesting thing to know is that there are a lot of disciplines that do not yet include animal-assisted therapy or treatment and animal-assisted education. They just don't offer standards for those quite yet. Some do. But it is worth it for you to do an online search to see if you can find one that speaks to your discipline. So, the interesting thing is, I've given you kind of the highlights of what Animal Assisted Intervention International covers in their standards. But when I look at the American Occupational Therapy Association and see, what is recommended, within the scope of occupational therapy, those can be very, very different, and they can be worded very different. The American Occupational Therapy Association, or AOTA, doesn't have any specific documents just for animal assisted therapy, although we've been working on them for years, hoping to get those through. But what we do see are recommendations, and we see other things like, hey, if you're participating in alternative or complementary sessions, here are the guidelines for that. You need to have continuing education and establish competency, and that means that somebody else has deemed you competent. Normally you practice something, and you do testing and evaluations, and there is supervision for it, and then you can test out and have your complementary or alternative treatment kind of sessions. And that's where animal assisted therapy would fall, or animal assisted treatments would fall, because we don't have specific documents for that. So take a peek in that folder and let's see if we have anything for you. And if not, you're going to need to do a little bit of digging and do an online search to see what you can find as far as standards or recommendations or guidelines for animal assisted whatever and your discipline. So now let's talk a little bit about competencies. Competencies are knowledge, skills, abilities, and behaviors that contribute to individual and organizational performance. Knowledge is information developed or learned through experience, study, or investigation. Skill, however, is the result of repeatedly applying that knowledge or ability. Ability is an innate potential to perform mental and physical actions or tasks. Behavior is the observable reaction of the individual to a certain situation. The target proficiency level for each competency will vary based on an individual's position and an organization's needs. And this is put out by the National Institute of Health. So, some of you are coming into animal assisted services or interventions completely novice. You don't know anything about it. And so there needs to be entry level competencies and sort of defined areas where you can start climbing that ladder of knowledge and skills and attitudes, right? So again, we're going to take a peek at Animal Assisted Intervention International competencies. And again, this is just because I know them, I helped write them, and I can get through it rather quickly. So Animal Assisted Intervention International members come from a variety of backgrounds, and the scope of each member's work is different. So we serve worldwide. We have individuals from countries all over the world and lots of disciplines, including dog trainers. We recognize that there may be people with different expectations and skill sets, whether it's volunteer visiting or expert instructors of any given member category. So in collaboration with Dr. Leslie Stewart, Animal Assisted Intervention International adopted her competencies, and then we adapted them. And so we looked at our standards and looked to see if Dr. Stewart had come up with any kind of competencies related to that. For the ones that were missing, we wrote them. We wrote competencies. And so Dr. Stewart and I have come together and done some work with a huge team to make sure that we have a competency, or more than one competency, for every single standard within our organization. So before we did that, there were several different versions of this document, and I just want to make sure that all of those are accredited because she had previous teams. But due to the nature of our membership and the roles that people and animals fulfill, we outlined 4 tiers of competencies for each member category. So, well, I'm going to use animal assisted therapy or animal assisted treatment as an example. And so you may be entry level, intermediate, advanced, or expert. And there are different competencies to achieve in order to reach those levels of competency. So the layout has changed from the original. The competencies have been rearranged from 3 to 4 levels, and new additional competencies have been constructed. And we have represented those in green. So when we're looking at the sample parts of the document that I'm going to show you, things that are in black are Dr. Stewart's original work, along with her team. And then the things that are in green are things that we have added and emphasized within the standards. So these changes allow individuals and programs to improve their skills over time as required by Animal Assisted Intervention International standards. And so it means that you're never done learning. You are always trying to better yourself, better the lives of your animals and how they experience the sessions, et cetera, et cetera. So let's take a look. Here are the competency levels that are summarized. You can see that there is entry level, intermediate, advanced, and expert level for different membership categories, such as animal assisted activity, also called animal assisted support programs, animal assisted therapy, which is also called animal assisted treatment, and animal assisted education. So within animal assisted activity, animal assisted support programs, and animal assisted placement programs, these are organizations that train or assist in training teams for animal assisted therapy. It is recommended that the minimum competency level required for lead collaborators within specific interventions are marked in bold. So this means that the individuals who are not bolded, they may not quite be independent in different areas because they haven't learned enough. They haven't had enough experiences, supervision, mentoring, et cetera, et cetera. In the case of animal assisted therapy or treatment and education, this minimum is essential as the intervention requires the active involvement of a licensed practitioner. And so, again, we are building in safeguards. We are making sure that the participants in animal assisted services or interventions know what it is that they are getting. So instead of walking in with a therapy dog, not knowing is this therapy or are there just therapeutic benefits? People don't know the difference, right? So we want to safeguard and make sure that roles are clear and defined. Okay, so the chart below is going to outline key knowledge, skills, and attitudes. And these are competencies for each of those levels. But in the example, and to save time, I'm only talking about entry level today. Okay, so entry level is an awareness. Do I have awareness? Maybe I'm a volunteer and it's my first time coming in, or I'm brand new to animal assisted anything and I'm apprenticing. I'm, volunteering and observing and doing everything I can to learn. So the definition of an entry level competency is that there are knowledge, skills, and attitudes required of anyone, human or animal, that is new to AAIs or services, and extending through operating at all levels in all capacities. The entry level encompasses awareness and initial implementation skills, knowledge, and attitudes that are reflected in the standards and competencies for those new to these services and member categories. So here's what that means. When it comes to knowledge, the expectation for an Animal Assisted Intervention International member, this is entry level, handlers and providers new to AAI should possess general knowledge about the provision of AAI with an awareness of the standards of practice. They should also possess a basic working knowledge of the health, welfare, well-being, and training of the dogs involved. And so we would also say, see those standards as well. But specifically for entry-level awareness, they should understand different disciplines within animal-assisted interventions or services, including all of the subcategories, and that they should be aware of skill levels required to undertake each intervention or treatment effectively. They should be able to explain the nature of the program in which they are involved, obtained through comprehensive induction processes covering paperwork, systems, participant, the population. They should also be able to demonstrate basic knowledge of infection control procedures, such as zoonosis. And remember that zoonosis are cooties that can be transmitted between humans and animals. It's not always the animals that can give cooties. Sometimes it's the human animal that gives the cootie to the animal we're working with. We want to make sure that everybody understands standard precautions, risk management, incident reporting, and protocols for hygiene and infection control, and potential public health crisis. So in other words, the cleanliness of dog and equipment, locations where AAI is appropriate. They should understand dog welfare and well-being and the needs and rights of a dog, such as, we can start from the 5 freedoms, which really started with farm animals in food production, but at least there were some freedoms, and they have been extended to domestic animals and added to and changed names. And there are a lot of systems that you're going to learn about in this course about that. But we also look at the operational details of the 5 domains: 1 health, 1 welfare, etc. We should understand that each dog is an individual and that skills, preferences, learning style may be different between dogs. And there can be differences in breed-specific traits, in individual dog-specific traits, individual horse-specific traits. Everybody is an individual, but we also have to look at DNA. What am I genetically programmed to do? So, if you get a dog who is supposed to be herding, then you can't go to a trainer and ask how to stop the herding. It is part of who they are and part of what they need. They need that activity, that kind of activity level, and figuring out where they would be most appropriate is critical. We also want people to recognize the preparation, training, aims, and objectives of a dog working in animal-assisted interventions or services, including temperament and typical skills that dogs are trained for. Understand communication between people and dogs. So that's verbal and nonverbal communication, and being able to recognize the subtle behaviors in each species so that they can work better together. And to recognize signs of discomfort, stress, or illness in dogs and of clients. There are a lot of telltale signs that, there are a lot of people that really want to be around dogs, but then they're actually afraid of them. And so, the dog comes near them and then they start moving away, and you might get the dog all excited. So the dog moves faster and the client moves faster. And then pretty soon we've escalated in fear. And so we want to catch those kinds of things before they happen. So within our competencies, we want people to understand those kinds of things in the entry level knowledge area. Now let's look at entry level skills. So handlers or providers new to AAIs demonstrate ability to describe the principles of AAI and demonstrate basic dog handling skills. So specifically, they should be able to demonstrate supporting a dog, like identifying and preventing signs of stress, the ability to consider and meet the needs of the participants, to evaluate their own skills. Some of us just are not multitaskers, and we would do better having a dog-human team come into our sessions so that we can give more of our attention to our clients. Ability to perform a supportive role to help providers to deliver those services. Now let's look at the attitudes. So Those who are at the entry level or awareness area should be working under the supervision of an experienced practitioner or mentor. And specifically, here are the things they should be doing: demonstrating awareness of their roles and level of responsibility, follow all procedures and policies set by the program to protect the well-being and safety of everybody involved, act in the best interest of their discipline, the program, the participants, and the dogs, to utilize a reflective approach to their own learning. How could this have been different? What were the highs? What were the lows? What can I do next time? Do I need to work with the dog? Do I need to make sure that my client has better control over impulsivity or problem solving before they can work with an animal? They should also demonstrate an understanding that animal welfare, well-being, and advocacy directly impacts participant safety, and that the dogs involved are the handler or provider's responsibility. They should demonstrate an understanding that animal advocacy is essential to the ethical practice. Now, here's the thing. I think that we all get something like performance anxiety. We have a client in front of us. They're expecting to do animal-assisted therapy. Our dog starts to wander off. The dog is on leash. We give them a yank, bring them back, and now the dog is hiding behind us. And so we move them forward or we move out of the way, and we're feeling like we have to force this dog to do something. But the dog is clearly communicating that it is not comfortable with whatever is happening. Now, it could be the client, it could be the activity, it could be the garbage truck that's going down the street outside. It could just be that they have to go to the bathroom, or they hear another therapist's voice or another client's voice in the next room, and they just want to tootle in to say hi. But we need to make sure that we advocate and say, wow, it looks like Spot doesn't seem to want to participate for a moment. Let's see if we can problem solve what this could be. So these are what we call teachable moments, right? We also want to be able to give accurate representation of our own education, training, and expertise and our experience level without intentionally or unintentionally misrepresenting knowledge, qualifications, scope of practice, or credentials. And again, that is why the terminology is changing. So when you are choosing standards and competencies from any organization, and there are a lot of really great ones out there, first, you want to consider your discipline. Look and see if you have your specific discipline and organization. For me, the American Occupational Therapy Association, do they have anything to say? Again, for me, it's alternative and complementary, right? Does your professional organization offer these documents? Next, consider the type of animal-assisted intervention or services that you are offering. So, are you offering more than one? Like in my clinic, sometimes we're doing animal-assisted activities. Most of the time, we're doing animal-assisted therapy or animal-assisted treatment. And so we need to make sure that we have standards and competencies for both. On top of that, we're a training facility. I'd like to see some training standards for that. We specifically train people to train their dogs to do this kind of work. I need standards and competencies for that. I need to make sure that I am doing right by any of you that contact me for this kind of training, right? We need to make sure it's buyer beware, know what you're getting. You need to also decide, do you need a membership to an organization? Are you just going to borrow somebody's standards, or are you going to be evaluated for them? At AAII, for example, we offer an accreditation to make sure your entire program and staff is following all of these standards and competencies. We also want to look at this. Is there enough detail within the standards and competencies that you choose to provide guidance for your level of practice? Are there guidance notes? is there some sort of a process that helps you identify where you are in your learning? Because here's the big thing. There are some organizations that have little tiny short documents. And when it comes to looking at things to, remember and follow, the path of least resistance is going to be that. But remember that you will need to write your own standards and competencies if you are not following those of others. So it means that if you are choosing an organization that does not meet your needs, or if your professional discipline cannot meet your needs with documents, then you're going to need to write additional supplementary documents, right? Because you don't want to have anything that is incomplete. You want to make sure those standards and competencies are tight, the same way that your ethical practices are for whatever discipline you are practicing. Okay, so that completes today's webinar. As usual, if you have any questions, feel free to contact us through email. We will do our best to get back with you within 24 hours. Weekends may not count. Have a great day, everybody.